30% of this course have back pain. Okay? And you all look so fantastic. How can you have back? I want you all to bend forward. Put your hands here and bend forward until you feel the pain.
До момента, когда у вас будет болеть.
Okay, so half of you are completely lying.
Половина из вас врете.
You have it. Which one? Okay, who's worse?
Хуже.
Okay. Okay. Yeah, this is the one. Yes. Okay. So. You're fine. Okay. Very interesting. Okay. What do you want to check when she has back pain? Hip. Hip. Yes. So quick assessment of the hip. This is how it looks like.
Быстрая оценка бедра, то, что вчера было. Вот как это выглядит. Вспоминаем.
No. Spin test.
Спин тест.
Looks good. Leave it. Let go. That looks good. Turn around this way. Just because I'm lazy. And that's fine. That's okay. I like hitting myself with this. Okay. And that's it. All I need to check with the hip. If this is fine, I'm not going to look anymore at the hip.
Если все в порядке здесь, то я
Next thing, straight leg raise. Yeah, lift this up. You don't need to do much about it. If it looks okay, it's okay. This
Не
one.
нужно сильно делать напряжение, если это хорошо выглядит.
Okay, that's fine. Sometimes if they have pain on one side, I test straight leg raise in side lying. So lie on your side. Sometimes. Not in this case, I don't need to do it.
Иногда, если
I will
только
just
в
show.
одной стороне, я оцениваю.
Hold this leg, bring it this way. And I feel sorry for her. Okay, stand down. Bend this one. Take it. Anyway, that looks good. We agree? Okay. Up on your knees to the sides. Okay.
Колени по сторонам прижимаются.
And if you imagine you have the spinous processes here,
Если вы представите остисты, вот это,
so you're going to have your hypothenar eminence here between the spinous processes, like that.
вы должны поставить вот эту область, то есть основание, между остистами.
And you're going to push cranially in this direction because the facets have this direction. Okay.
И толкать крайне.
Basically, you can think of it as stretching that area. It's the same.
Фактически вы растягиваете эту область.
Malligam talks about mobilizing the facets and the joints, but
Маллиган говорит,
it's difficult to say what is happening here.
мобилизация суставов, фасеточных суставов. Ну, сложно сказать, что там происходит.
Palpate in this position and see where is the pain.
Пальпируйте это положение и спрашивайте, где болит.
Lower? Lower? Okay. So we're all the way down around L5, that's one region. Okay. So L5, you cannot do this because the pelvis covered. You cannot use this mobilization. So you're going to have to use a finger. We'll do that later. So I'm going to mobilize from L4 and see what happens. So this hand is going to be here. The other hand is going to be around here, just to give her some comfort.
Сверху рука лежит. Таким образом, сзади мы поддерживаем.
Okay.
L5 и ниже мы другую мобилизацию делаем, она будет позже. Поэтому это то, что L4 и выше уже так.
I stand close to her
Где-то
and
она
I
будет близко,
turn in this direction because
поворачиваем.
I want to be pushing my weight forward while she's going backwards.
То есть я должен вместе со своим весом полностью толкать.
When she goes backwards and I'm pushing upwards, you can imagine you creating some kind of a stretch or a mobilization in this area.
Когда я толкаю вверх, а она делает движение в обратном направлении, то вы можете представить, происходит растяжение и мобилизация этого образования.
If the pain is central, that means pain on both sides.
Если боль центральная, с двух сторон одинаково.
You will use the central technique, so you're pushing spinous process in this direction.
Центральная техника, когда вы в этом направлении между остистами.
If the pain is unilateral, if you mainly have pain on one side or the other,
А если латерально, односторонняя,
you stand on the side of pain and you mobilize from here.
вы становитесь со стороны боли, мобилизируете с одной стороны.
The direction of your hand is going to be a little bit different. If it's central, it's going to be like this. Okay?
Центральная – это вот таким образом рука.
If it's unilateral, it's going to be a little bit like this.
Если латерально, односторонняя, это слегка повернуто.
It will help to think about that your hand is going to be in the same direction as the ribs.
Для того, чтобы представили в таком же направлении, как ребра располагаются.
So palpate the ribs in this position, the ribs are like that, so your hand is going to go in the same direction.
В таком же направлении, как ребра, можете пропрактиковать.
If you mobilize on the opposite side, it doesn't work. Because unless you change your handling. Because the ribs are pointing this way, and you can imagine if your hand is pushing in this direction, you're going to create compression.
Вы не можете таким же образом противоположную сторону мобилизировать, потому что вы создадите компрессию, ребра расположены симметрично.
But people would say, okay, there are no ribs down here. I know. But when your hand is like this and they're going backwards, everything is compressed in that direction. So you're actually compressing
Даже
the
учитывая, что вы
area.
работаете на более низкой области, где нет ребер, все равно идет движение и общая компрессия.
So I'll do it now. Get in here, hold around, and ask the patient to lift your back up a little bit. Yeah, just
Просите
like that.
пациента слегка,
You get a better contact this way.
для того, чтобы лучше контакт был между естественным.
Notice how close, okay? I'm not here. I'm very close. Of course,
Близко к пациенту.
I would tell the patient, I'm getting very close to you. Is that okay? Okay?
Я говорю об этом заранее пациенту, что я буду очень близко к
If
нему.
she says no, go somewhere else.
Если скажешь нет, посидит в другом терапевте.
Okay, lift it back. And go
Поднимаем
backwards.
спину.
When she go backwards, I'm pushing forward. Okay?
Когда она идет назад, то есть выполняет движение назад тазом, он толкает, я толкаю вперед.
We can do few of these without movement. Just hold against. This is the original technique, Molligander. No, it's back.
Оригинальная техника, вот, фактически без движения, она толкает назад,
Okay.
он вперед и
One more
релакс.
time.
Еще раз.
Is that okay? It shouldn't be painful.
Это не должно
We
быть
did
больно.
3. Get down and test. Yeah. Test the flexion. This is what we're interested in.
Here.
Nothing. It's the same. Yeah?
То же самое?
Yes, it's the same.
Maybe
5S1 region. And don't worry about the grip, I'll show that later. Okay.
Опускается ниже уровнем L5.
Now I'm going to have her move all the way. I could have done this and go back all the way. Okay? I could have
И
done
вы
that.
с движением. что-
But I think since she doesn't have any change, it's probably the wrong level. So,
Возможно, если нет
I'm not going to
изменений
explain that.
функции, то не тот уровень
Okay,
социальной
get down
работы.
to the body. Yes, that's it. Okay, is that okay? Okay. Get down and just. What do you expect? Can you see that it matters which level?
Видите, есть разница, на каком уровне вы работаете.
No pain. Nothing. Okay, sideways to the camera. Just to the side. And this. Why do you bend your head first?
The first?
You don't need to bend your head first. You just need
Не
to.
нужно
Just think about, yes, just bending forward. Yes, exactly. Okay, that's all you need. Yeah. That's good. Okay. Yes, that's it. $5. Just bend forward and tell me when the pain starts.
Когда начнется боль, скажешь.
Okay. Back again. I'm going to change the way she's moving. When she moves forward, she's bringing her hip backwards and extending her knee. So it's not the best way of bending forward. Stand up again.
Он хочет изменить ее движение, потому что когда она наклоняется
Bend your
вперед,
knees
она
a little
слишком
bit.
разгибает колени,
Put your
переразгибает,
hands here.
наклоняет таз назад.
And roll down and let go. Let your hands go down along the way.
Чтобы не было переразгибания,
Keep
отклонения
on
таза
going.
назад.
Any pain?
Пальцы.
Ah, she, okay. Typically, it's the pattern, but in this case, she's still having pain, so it means we will treat it. Shall we check quickly anything in the hips? Anything in the hips or straight leg raise? Did you have anything in the hips or? Let's just test it quickly. Yes, fine, yes, fine. Okay. Lift this, relax. That's all right. Good. No problemos. Lift this up. Or turn around. No problemos. Okay. Straight leg raise. Up. Lift it. That's okay. In the schools, they will tell you, oh, you have to do like this, and too much bullshit. Just lift it, see if it's okay. Okay. Sideways. So those who teach in the schools, be nice with people. Tell them just lift your leg.
На боку.
Ah, okay. And leg it. Any problem? No. Other way, other side. Around. Usually legs to the side. If it's Bobat bed, take it easy. Okay. Okay. You can keep the t-shirt on. If it's hot and sweaty, you can use. It's fine. You can mobilize with the t-shirt. If not, get a sponsor. What is the
Если
pain?
возьмете спонж, вы можете через футболку мобилизировать.
Де болить?
Here? Okay. This is different. The pain here is L2, L3 area. Yeah?
L2, L3 это область.
L2. Okay, so it's a high
А
signal.
выше уровень, чем
So if it's L2, 3, you are in contact on L2 first. Okay? That was
А
fine.
если L2, L3, то вначале контакт с L2.
Yeah? You can hold like this. Better? Stay there. And lift your back up and push back. Go back. Yeah. Keep on back. Keep on back. And forward.
Вперед.
Forward. One more time.
Еще раз.
And relax. One more. Relax. Mulligan does usually only this. He holds against. But you can combine it. I typically take it all the way. I want them to sit back. Sit back. If there's pain, you stop. Okay?
Если болит, вы должны остановиться.
One more.
Эмалиган использует в одном направлении, я иногда комбинирую.
Is that okay?
Вперед-назад.
Is that okay? Test. Get that. Doesn't bend forward.
Не подведи, не подведи. Терпимо.
Okay. $10 because this is better. Pain starts. Tell me. That's it. What is she doing? Have a look here. Completely straight. You can eat your dinner on this back.
Вы можете кушать, принять пищу. То есть
Completely
очень
flat.
ровная спина.
So you want to roll down. If I change the pattern, maybe it's not like that. So I want you
Возможно,
to
неправильный паттерн
relax
движения,
your,
поэтому
relax
вначале
your
лучше
knees,
правильному движению.
put your hands
То
here,
есть согнуть колени,
and roll
расслабиться.
down, roll,
И
let go,
начать
let go, let go. Let it
другом-
go.
в другом
Pain
паттерне
again?
двигаться.
Pain, okay. If you get pain when you change the pattern, then you need to do
Если в
something.
правильном паттерне
Okay?
боль, значит нужно
But many people, you change the pattern and they can move. Okay?
иногда
Not in this
изменение
case.
паттерна приводит
Yes. Friends, I usually put my hands
возможно,
this
что
area
большая нагрузка на эту область, поэтому я
Yeah, just
становлюсь
relax.
подобным образом.
and I say try to bend and make yourself tall. Okay? So Bend back.
Руки поддерживают.
Is that any different?
Есть
Is it any
разница?
different?
Да,
Different.
есть.
Okay. So I come here, I'm holding her, I'm pushing her up.
Я поднимаю, поддерживаю, поднимаю вверх.
Bend back. Keep on going. Keep on going. And forward. Okay. You get it? You get pain? Yeah, you stop when you get the pain. Okay. One more time. Okay.
It's the end of
At the end. But I start to get pain, so we're not going to do more. Try to bend backwards now.
Сейчас попробуем назад. Сам.
Вытягиваться больше вверх.
Different? Pain. Okay. Okay. How long time did you have this?
Как долго? For a long time. Periods.
In period.
In periods, but for a long time. Many
Yes?
years. Many years. It was pregnancy.
But with pregnancy. Put the knee down. Okay. This one up. Okay. Just this is. I don't need to do much. Just to have a feel. If I feel this, I don't need to do more.
Если я чувствую
Okay.
нормальное движение, то я не делаю много.
There you go. That's it. Straight leg right.
Прямой.
Good. Next. If I want to test sideways, I test this. So here. Up on
И
your
вижу
knees.
необходимости наоборот тестировать.
That's very low. This area. This is in the center. Mainly in the
Центральное,
center.
одинаковое или
Или вправо-влево.
центр?
And again, it's very low. It's around L5.
Это где-то L5.
So it's difficult to use this grip. So I'm going to use
Этот захват сложно
It's like that.
использовать на L5.
lift it up. Lift it up. Lift your back up.
Поднимай
The other way. Up, 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 up. More, more. Until I get in touch with this area. So I'm using a grip that looks like this. Okay, on both sides of L5. Is this okay? Is this okay? Painful?
No.
Not pain? I know the pain is there, but I cannot move this. It's too deep. So I need to put my fingers around this area.
Там слишком
Там
глубоко. Да,
Lift your back, wait,
Назад.
and now push back.
Назад.
Go back.
Толкай назад.
Толкай назад.
Tell me if you feel anything.
Если будет какое-то ощущение,
Еще толкай.
You have to tell me within 10 minutes. Okay? When you go backwards, you let your head relax. Okay? So you don't want to extend your neck when you flexing your back. Is
не
this okay?
напрягайте шею, когда делаете.
Is this хорошо or no? Okay. Okay. I can try, because it's difficult to mobilize this area, I can try to mobilize higher up. So lift this up
Сложно мобилизировать
Lift
эту
up.
область, поэтому я пытаюсь мобилизировать чуть выше. Сейчас.
and go back.
Назад.
Push. Oh, up.
Толкай, толкай, толкай назад.
Push. 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 One more time. Push. All the way. That's it. Is it painful here? No? Okay. Why don't you go more back? Come.
Еще сильнее
Go
назад.
as far back as you can.
Это столько
Stop only when you feel pain. Okay, come back.
до конца.
Continue.
До конца.
Continue.
До конца.
That's it. Okay? So this is what we want. We want her, stay there.
Что мы хотим?
We want her, if she can, to go all the way down here. Okay? If it's pain-free. Is it pain-free to be here?
Это безболезненно для тебя сейчас? Yes, painful.
Pain-free. Okay, come down and test.
Низ.
What do you expect? Good or not good?
Копать картошку.
Between you. First of all, you have to have an idea, where does the back start?
Вы должны понимать, где начинается спина.
So it starts from the pelvis. So you're gonna have to feel the pelvis.
Вы должны почувствовать таз.
And there where your thumb are, that's where the beginning of your back.
И вот отсюда начинается спина.
Anything else down here is just sacrum and pelvis. So the back starts here. L4-5 is around there.
Да, L4, L5 как раз вот здесь рядом.
Okay. Now, if you have a bigger person like me, maybe you're gonna feel the pelvis. You're gonna be around here, but it's an estimate. Okay.
Да, то есть человек может быть и больше, но при этом вот эта линия.
So you estimate that
показывает.
by
Да.
feeling for these bones.
Здесь
Now,
подвздошная, да, с подвздошным
if you feel that,
Если
then
вы чувствуете,
you can basically think you're drawing this, and then you have a sacrum here.
вы можете
It's
нарисовать.
bigger
да,
than that.
да.
Okay, that's the area. So you have sacrum and you have the pelvis here.
По
L5S1 is going to be in this area, somewhere here.
L5, S1, вот та точка, которую он кружочек.
You don't know where it is exactly, but you're gonna try different places
Я
here.
точно не могу сказать, но я могу пробовать разные
So
точки.
I put
в
my
этом
finger
случае.
like that. Is this okay?
Я опускаю здесь палец, хорошо? Да? Окей.
And then I push with my other finger
И потом,
through the
когда я нашел
tissue. Is this
точку,
it's painful?
болит? So.
So I move.
Я перемещаю.
Is this okay?
Окей? Not.
Not okay.
Painful.
It's painful.
Painful. Yes.
I just want to know if it's painful. Not okay or not okay. It's confusing.
Если болит.
So, is this painful?
No.
No. So I stay there.
Остаюсь здесь, там, где не болит.
Notice how my fingers are like a crab. They just catch everything. Okay, so
Как краб, ты схватил...
I
всё,
stabilize my fingers there. Is this still okay?
Стабилизирую с пальцами.
Okay. Now go back.
Идем назад.
When you go back, you would feel that I'm holding against that.
Вы чувствуете
And forward.
сопротивление. И вперед.
One more time.
Еще раз.
And she would feel the pressure. Of course she
Она
feels the
будет
pressure.
ощущать давление.
But
в
it
этой
shouldn't be
точке.
painful.
Но не должно быть боли. Давление.
Да.
You push, you push
I
here,
push up in this
up.
way. Yeah,
Да,
it's the
сделай-
same. And now
толкай
you
вперед.
retest your movement if you have. It's the same. Get up. Now a different thing that I will do. Yeah, just below. This didn't work.
Если не работает,
I'm gonna have the pelvis here.
здесь таз.
I'm going to push at the pelvis in this direction.
Я буду толкать таз вот в этом направлении.
Okay. I can push at the sacrum and I can push at the pelvis. Yeah, but I'm
Я
going to
буду
push it.
толкать на подвздошную.
It's
Воздушно-крестцовое
just
сочленение.
like this, okay?
Воздушно-крестцовое сочленение
Is this
в направлении,
okay?
которое я показал.
And
Да.
try to go back.
Бывает.
Is this okay? Okay. Let's just do a few of these. Come back. So I'm pushing in this direction, okay? That's all. Stabilizing here.
Стабилайзер?
Yeah, just gently, just as we did with the snail. Right
Мягкая
there.
стабилизация, если то он не
То есть, ну,
Okay, try it.
может быть, как раз воздушно-крестцовое.
Cool. That looks better. Yes, do it again. No, bend.
Еще.
So that helps. So put extend and flex and get back. Okay, it's easy. Stand up. Ah, you like it. Okay. Ah, that's good. Yeah, backwards.